Hello there, viewers. People usually want to have the best quality of sleep because, as you know, a good sleeping pattern is very essential to function throughout the day. Yet some sleeping disorders may stand in your way. Today, we'll be sharing with you some ideas about sleep disorder called sleep apnea, its causes, and how it affects your health. Sleep apnea is a highly serious sleep disorder that occurs when people get their breathing interrupted many times during sleeping. There are two main types of sleep apnea, obstructive and central. The first type, which is obstructive sleep apnea, is the more common type and occurs due to direct obstruction of the airway. Have you ever been asleep and suddenly you woke up because you felt you were choking? That's exactly how it feels with obstructive sleep apnea. Welcome to Beyonce. If you are new here, subscribe to our channel and hit that notification bell so you'll never miss our future uploads. Here is what happens when you breathe normally. The air flows in through your nose and mouth down to your throat, also known as the pharynx, then down through your trachea or windpipe until it reaches a tree-like structure of small tubes in your lungs. When you breathe, a negative suction happens that draws soft tissue in your mouth and pharynx inward. But at the same time, this soft tissue has some muscle fibers that allow recoil and prevent obstruction. That's the mechanism that keeps your airway open. But when you are asleep, your whole body becomes relaxed and likewise the muscles in your mouth, tongue, and pharynx. However, it doesn't relax enough to block your airway. People with obstructive sleep apnea have muscles that relax a little too much that they collapse and obstruct the airway. When they lie on their backs, the tongue falls on the roof of the mouth and presses it against the back of the throat, leading to complete obstruction of the airway. The lack of oxygen in your lungs and tissues wakes you up gasping, and it may even get harder to fall asleep again. This irritating process occurs multiple times during sleep, leading to a group of symptoms such as repeat episodes of choking or gasping, waking up with a sore dry throat, restless sleep, loud snoring, which is a strong indicator of sleep apnea, lack of energy during the day. It can lead to sleepiness during the day and insomnia at night, mood changes and memory problems, severe headache during the day due to lack of sleep. It may be severe to the extent that it may induce drowsy driving and road accidents. This sleep disorder is not exclusively limited to a specific age group, but it affects all ages and both sexes. Researchers have found that there are certain risk factors why some people may suffer from obstructive sleep apnea. Number 1. Obesity. Excess body weight will consequently lead to fat deposition around your upper airway, which naturally will narrow your airway, making it more susceptible to obstruction. Number 2. Neck thickness. Not all people, but those who have thicker necks may have narrower airways. Number 3. Genes and family history. The narrow airway or the large adenoids or tonsils may be running in your family. Number 4. Smoking. Smoking will increase the inflammation and congestion in your airway. Therefore, smokers are more likely to develop obstructive sleep apnea. Number 5. Advancing age. Sleep apnea is more significant in older adults. And number 6. Some medical conditions. If you suffer from allergies or any nasal anatomical abnormality, you are more likely to develop sleep apnea. Some of these factors are easily preventable and can be avoided. Now, the second type of sleep apnea is central sleep apnea. It is the less common type in which, unlike the obstructive type, there is no problem in the airway, but it is rather a central problem, in other words, in the central nervous system. The brain fails to send signals to the respiratory muscle so they can do their job and make you breathe. Stroke and using narcotics are two main risk factors for developing central sleep apnea. Now, how can someone tell if they have sleep apnea or not? Usually, a sleep study, also called a polysomnogram, is needed to diagnose sleep apnea. It monitors sleep state, eye movement, heart rate, blood oxygen levels, respiratory effort, muscle activity, and airflow. Some doctors depend on the information they get from patients or their partners, whether there is snoring, the sound of gasping, or they might even listen to a recording of the patient's sleep. Now that we know all about sleep apnea, what is the possible way of treating it? That's a smart question. The short answer would be, it depends. Treatment of sleep apnea varies according to type and severity. The treatment of choice for sleep apnea is to keep positive pressure in the airway to prevent its collapse. And that's when the CPAP or the continuous positive airway pressure devices role comes. It is a mask that covers the nose and mouth during sleeping, blows the air gently in the airway to keep it open during sleep, but usually that kind of treatment is based on the doctor's recommendation. What about some lifestyle modification or home remedies? Lifestyle changes are markedly effective in reducing the severity of sleep apnea. Here are some tips to mitigate the symptoms. Maintain a healthy body weight. It'll keep your airway open and reduce the symptoms. Quit smoking. Quit it as soon as possible for all the health benefits. Change your sleep position. Although it might seem a small change, it can reduce the symptoms effectively and give you a good night's sleep. So next time, try sleeping on your side. Use dental and oral appliances. They can help reposition your jaw and your tongue for better breathing at night. Use a humidifier device. It gives you a moisturized air to breathe, which will reduce congestion greatly and will keep your airway clean and open. Raise the head of the bed about 60 degrees to reduce the number of episodes of apnea. It might help people whose condition worsens when they lie on their backs. Do yoga or exercise in general. It will strengthen your muscles and regulate your breathing. All these lifestyle changes can help people with mild apnea, but some cases will need surgical intervention if resistant and severe. Surgery is not the first option, but it is the only option after the other treatment plans have failed. So as a take-home message, if you have any difficulties, talk to your doctor and be safe. Which type of sleep disorder have you experienced before? Did you know anyone who has such kind of problem? Let us know in the comments below. If you find this video helpful, give us the big thumbs up, subscribe and click the bell so you'll always get notified whenever we upload great tips like this one. Oh, and remember, sharing is just one click away.